Welcome, dear viewer, to Let Us Kick COVID-19 under Monday Akol Amazima. Now, we look at how society rises and falls on leadership. This as we look at local leaders, how they are actually facilitating the fight against COVID-19. With me is the chairperson of Kamuli C Zone in Chireka Parish, Namugongo Division and Kira Municipality. Mr. John Lubega, you're welcome.
I'm blessed to be here. Thank you very much for entertaining me here tonight.
Yeah, and it is COVID talk. We are talking about this pandemic that is ravaging actually every other day. You hear that so-and-so has passed on, so-and-so is in ICU, so-and-so is in isolation. So actually now COVID is real. Everybody is now feeling the heat. Unlike the first time when it was more of a rumor, so much that people thought that was a hoax. Now let's look at in your village, in Kamuli Zone C. How are you helping the people to fight, to cope, to stem the spread of COVID-19?
Thank you very much. Once again, my name is John Lubega, and the chairman of S1 Kamuli C. We are found in Chireka Parish, in Namugongo Division, that is Kira Municipality. I've been a leader there since 2001, and I have a village which has about over 15,000 people.
15,000 people?
Yeah. I have youth of about 2,000 below 18 years, and I have about 10,000 people above 18 years, plus elderly, whatever. So, all in all, I have about 10,000 people who are fit to be vaccinated.
Yeah, your area is actually an urban area, and that is where we find that COVID is more serious in urban centers.
Yeah, it is urban and also semi-urban, in a way that in this area we find people who are vulnerable. Vulnerable in which way? These are people who work for hand to mouth. They cannot afford a mask. They cannot afford a bottle of liquid soap to sanitize.
Actually, research statistics show that the most vulnerable people are not in the village, actually in urban centers.
Well, yes. It is terrible. And in my area, since this month started, we've lost over 10 people.
Oh, that is so sad.
Even tonight, we lost a senior person.
To COVID-19.
COVID-19. It is real, and people are starting to know it. And in a way, as leaders, I and my local council, we don't look at that people, we look at our people who elected us. How are they going to survive it? How are we going to survive this? The issue which brings me here to UBC is not about I, it's about we. How we do go about it. We have instructions from the president to fight COVID-19. We also have instructions from the RDC Kira Municipality as LCs to tackle, educate, sensitize people, and make sure that COVID-19 SOPs are followed without favor. We need a society which is healthy. So we came up with a solution.
And what is that solution?
The solution is we should come up physically. We were instructed by the RDC to form a COVID task force of 11 people.
At the village level. And who sits on that COVID task force?
And we have about teachers, we have elderly people, we have HVTs, village personnel. This one used to move with bags to give people medicines. And also we have counselors, LCs, to be part of them. So We have one each in each department, and now we have already chosen them. Yesterday I had to educate them how to follow up the issues. One, I had to show them what are the factors which are going to lead on to hang on. It's about follow-up of SOPs. These SOPs were written in Uganda, and we have hard copies, small hard copies we are going to leave with each person.
Every household
should have a small paper like this one in Uganda and English. Talks about how to avoid each of it. One of them is like you see, we tell them wear clean masks, wear you're covering your nose. We should have a discipline of putting on masks.
That is, you properly put on your
it's
mask.
not about fashion show. We are telling them keep social distance, at least 2 meters. We are even telling them wash your hands with soap and sanitize. Avoid touching your face. These are the information they have. Don't touch your face. Don't touch your nose. Don't touch your ears with the hands.
When I Chairman, the other issue, you've actually talked about masks.
Yeah.
And this reminds me sometime last year when government gave out free masks. One, did the Kamuli Zone C receive the free masks? And if you did you manage to actually distribute them?
Actually, we did. We received them. But unfortunately, let me say this. I don't know who gave a contract to people who made these masks. They were poor.
They were poorly made.
Very poor, from hard materials, from rough materials. They were not really fit to be on the people's faces. They were very hard, catchy materials.
No,
what I'm saying, we had them, we received them, we gave them out.
Yeah, we learned by mistakes, because that was the first time the Uganda actually was coming up with masks. So
yes,
I believe now this
but I'm trying to
around,
deliver that message, that they received them. But what if now you want to give it back? Because I'll have some of those which remained. I was going to give them out, but they were refusing them. They would go for this one of 1,000. They would use for one, which was meant for one day. But then
they could not go with the reusable ones.
No, they couldn't. So what did we say? We said no. We have some small money on our LC accounts. Usually in Namgongo division, I thank my town clerk and the treasurer of Namgongo division. I think they've done a great job in giving us this little money from 20% which comes to LCs. I've told my LCs, you people, we should learn to work, but this little money should come to social services.
So, and how have you now so far?
How has it come? We have moved some money from there.
Yes.
We have managed to make about 1,000 masks by ourselves, and it's a simple mask. And these people were making them. They were contracted by also Ministry of Health, and they're making them, and also blending them with our zones. Kamuli C.
I can see, yes, there is
Kamuli C. Kamuli C.
Yes.
And also putting there, stay safe. Very comfortable. And today, the RDC officiated giving out about 300 masks to vulnerable persons in our villages.
Yeah, but you just said you have about 15,000 people.
Yeah, we are trying to get to 1,000 first.
And here you've made 1,000.
1,000.
So how are you going to cater for the rest?
We are doing it.
Okay.
We are doing partially. Because we got little money from our account, and also some good organizations around, like companies around, are giving us some little monies and adding more. In fact, we are adding more, and we have just been paying there 600,000 or more. So the making of this masks is going to be continuous, and people are comfortable with these masks. Today they welcomed them. We have also bought about 20 jerrycans and 30 jerrycans of liquid soap. We are giving people also liquid soap, so that we tell them, please sanitize, wash your hands when they see the soap. We tell them wear masks when they have free masks. And also we give them these hard copies. Please follow the soaps.
You can read in Uganda or in English?
Both in Uganda and English. I have a multilingual LC.
in English.
In English. I have Bagandas, therefore their messages. So today, our RDC launched the task force to go in.
Now, your area, that is in Kamuli Zone C, of course, it is an urban center with a number of business people, with actually a number of offices and also NGOs. So how are you mobilizing them so that they can support this cause?
Very much so. Thank you very much. Last year, when the president put up the task force for COVID-19, we managed as a local council. And we did this one because we wanted to show other local councils that we can do it. We can manage it with the state. We can manage it with the president's call. We managed to get 1 million shillings from our account. We gave it to the president. To the state, I mean, not the president, but
to the national task force. Yes.
After that one, we also looked for food from organizations. We have companies like Global Paints, David Engineering, Interfreight, Coin Freight, all those people, they have given us money. And they've seen us using the money for the right purpose. We have Miracle Center in Chireka, they gave us $1 million. We have people, personnel in government. General Katumba Bumara gave us about food for about 20 bags of cassava. We gave people food. We were trying to see that we fight COVID-19 with the state. Because the state will not look for these people. We are the people who are with these people. We must make sure we use these companies to give us more money, and they will give us more money. I have promises about 1 million shillings coming in next week. As soon as they give it to me, I dump it there. They make more, because this thing is going to be continuous. The disease has come, we should fight on. The stock continues, we fight on with masks, and this task force is going to be continuous.
Now, let's look at how your village or your zone is dealing with emergency cases, where perhaps somebody in the middle of the night, they are bad loaf, and perhaps they would need an ambulance, they would need to be perhaps lifted to a nearby health center.
Good enough. God has blessed us with 2 vehicles around. Some of us have about 2 vehicles. I've even put on task force, this is on task force, village task force. We are also someone who has a big vehicle. We have also given it to us. We have put free petrol there. We have given them free calls, numbers. They call us at night. We drive them to the nearest hospital. We are even advising them now that they should not use too much herbal. Don't use herbals so much. Please go to the nearest center. Get advice. Is there fever? Get advice. Don't use too much herbals, you may kill your immunity. That's what the messages we're carrying on. That they should seek advice. When you have a fever, when you have a smoke off,
and the Ministry of Health actually has come out clearly to say self-medication is bad.
And that's
please seek medical advice.
Yes.
Go to a specialist so that they can prescribe.
Yes.
Depending on your situation, and so that really you don't again cause problems for yourself, as and when you're trying to.
That is what we are doing house to house. Our village task force. We are giving them some little monies to make them. Almost each of them, we can give them 10,000 to move village to village. I mean house to house. Please, what are you doing this one? Please don't take too much medicine. Are you having some fever? Are you having some cough? Avoid this one.
Now,
the medicine.
The president has also been quoted saying that you local leaders should have a team of vigilantes, those who are going to see that so and so is not putting on a mask. In other words, where you can help the police, because there are some villages where actually the police may not reach. So, do you have such a team of vigilantes who will look out, say that so and so these people are not putting on masks? This group does not have water and soap at their entry. So, have you come up with such a team?
We have a team of 11 people with masks. I mean, with overcoats there, with our lighting. Community Zone Task Force.
Because that is the task force, but we're saying a vigilante.
Yes, vigilantes, they are there. We have them, 11 of them. We don't have to make them too many. We have another, that one, it moves there, but we have another 10 of them. moving, also putting on jackets to enforce. I'm heading them on the head. We close shops. We close shops. We close those who are not following it. Even on the way when we meet you, when you are not putting it on, we make you to put it on. Now, like we have made them to buy them this one mask. It's going to be very easy for us to tell you where your mask, as long as you are out of your house. Wear a mask. Where is it? Where is my mask? So it's a mask. You must put on your mask because we wanted to lead by example. You cannot force someone to put in a mask when they cannot have food.
Now, Bona Chairman, Chireka is known as a beehive of fun. And so much that even when the president has said bars should not open, it has been reported that some people are sneaking into those bars. You as the leaders, what are you doing about this?
In my area, I'm one of the chairman, they say, I have too much to get. And I think I don't entertain that one. Of late, I'm seeing a few bars. I've already informed the RDC. Because some bars are very violent to us as LCs. The police is very small in number.
As compared to the people?
Yes. Chireka is a business center which has over 30,000 people. The police has few people. But each LC, if each LC had a task force like we are having, the law should be in order. Because now, like me from here, when I'm moving, we are going to move with my people. By 8, all business should be what? Closed. By bars, all these people who play pool. If you don't have a mask, take it off. I take over the balls. I have them now in my office.
Now, let's get to that, because you've talked about the polls. The polls are always in bars, yet the president said bars should close. So how do they play pool when the pool game is part of the bar?
I want to be honest to you. The issue of the bars in urban centers has failed.
Why is it failing?
It is failing because leaders are not doing their work. They think the police will come from top. They think the other DC will come from the top. They think because the president will come from top. No. The onus is on us, on leaders, to enforce bar closures.
Now, Mr. Chairman, you just said you have a team of 11 people.
Yes.
You have also a team of 11 vigilantes.
Yes.
How do you fail to handle the bars? Because ideally, you also have the support of the RDC. You also have the support of the president. You have the support of the police. Why are bars operating behind doors something that is actually endangering people's lives, something that is actually now spreading COVID-19, as the president put it?
You were asking me generally in Chireka, not in my zone.
Of course, I'm looking at Chireka because your zone is part of Chireka parish.
Yeah, but I care about my zone.
Okay.
I care about my zone. Even when I'm making these things, I made them for my zone. Even when I'm making liquid soap, I made it for my zone. Even when I'm making these instructions, I'm making particularly in my zone. As I'm talking now, even bar owners are hearing, and they know when I come from here what I'm going to do to them. Closure completely. They know shops have been closed. After making agreement with them, we open them. I think in my area, things are going on well. But I think, why am I talking about this one? That what is happening in community should happen to other zones. What is happening to others in Uganda? LCs have the mandate to take care of the health of their people and security. It's honest. The onus is on us to make sure we move house to house, bar to bar, shop to shop, to make sure that we enforce these COVID rules. It's not about anything any person is. Why I'm here to say that local leaders, LCs from Kira, from Namugong Division, from Uganda, the disease is real. It's about us to move house to house.
Well, and how are you working with the security? Because we have the police and the LODs used. In the past, we saw, of course, the LODs failing to work with the local leaders, so much that at times, actually, they would perhaps overreact. At times, they would, instead of preventing crime, end up committing crime. So how are you working with the LODs and the police?
I'm happy to inform you that in my area, I fought very hard last 2 years to make sure there was a lot of insecurity. Now I have a small post.
A police post?
A police post, which is manned by about 4 policemen. We have an OC with an OC there with 2 stars and the 3 people. We move with them at night almost up to 11 on a daily basis. And they are not hard people, they are workable with. And we are working hand in hand. And we are really trying to enforce it. And they are doing a good job with us. And Kamuli see, if you were to question the RDC, how is it the security part of it? I think we are doing well. What should I do? Please, LCs, it's a call on you. The job is on us. The job is ours. Let's go beyond and we care on our people. Let's enforce the law. Let's not fear the law. We have it in our hand. The president is supporting us. Anyone who will be violent on us, the law will catch him. Let's go and force people to make sure they follow the steps. That's where the life will begin.
Yeah, and let's now go to the girls, because your zone actually has been part of the zones in Chereka where you find a lot of redundant girls on the streets during the day and in the night. How are you handling this?
Of late, my zone is a bit inside. It's a bit inside. We have Chireka A, Chireka Central, which is on the street. Mine is a bit inside. And it's boundary, it has boundaries. What we do, we wait on our boundaries. And they know it. They know the chairman is there. We walk with you to where you stay. We question the parents. And we are working with parents to make sure the girls are not impregnated. We are working with parents to make sure the children stay where? At home. And that's why when we're making this also, this masks, we also made for children.
Unfortunately, most of these girls are either university students, or maybe staying 3 or 4 in a room, and perhaps they are renting around there. So that is the category. So how are you handling them? Do you have like a Nabachala in Chireka?
We have a Nabachala. Yes, we have a Nabachala.
Zone C.
But these people, they are hardcore. We are bordering Banda. My zone is bordering Banda.
Yes, of course, where there's Chambogo University.
And it is becoming a hardcore. They are hardcore girls. And we are trying to work with the police now. We are handling them, we're calling their parents also to tell them, are these the children sent us here? Because I have so many hostels in my area.
Yeah, and that exactly how are you working with the education institutions around it? Because now you're neighboring Banda, which is actually which is where you find Chambogo University, part of Chambogo University. There are also some secondary schools around that place, and some of the students who come very far are in hostels. Actually, some of them in the 42 days partial lockdown, some of them have actually stayed behind. So now, how are you handling this so that you don't get cases of girls being raped, girls being impregnated, girls actually out of redundancy doing dubious things that would end up actually spreading COVID-19?
Of late, I want to admit that part has missed us. But I think this is the call on us to make sure to work with hostel owners. We work with the parents. We are not we're going to work with universities because most of them are outside our our jurisdiction. But as long as they enter this side, we want to work with hostel owners to make sure that the security of their areas or their hostels is manned very well, and also they follow the SOPs. I think that's the call. And in fact, what we are doing now, we are going back to register all hostels and to know which number of guys are there, and even the youth, to make sure that we know which youth stay in which hostel. We have the capacity to handle them.
Well, time is not our best ally. I would wish that you look into the camera and your message to your fellow chairpersons, LOC1s in the country. What should they learn from you, or what is it that you ought to do so that you can actually control the spread of COVID-19 at village level?
Fellow countrymen, fellow LCs, I'm a mayor chairman of LC1. You may not do a mask that I've done. You may not supply liquid soap. You may not carve flyers on your backs of your people, but you can manage the village by informing people, forming groups, forming task forces, to make sure that you make people to know what they are meant to do, to enforce shops, to enforce shop owners, to make sure they put on masks, to make sure that the people they are serving have masks, to make sure people have a distance between them, at least 2 meters, to make sure when they are moving out of their houses, they should not forget their life back. One mask is a life. That is my message in my village. Your village should be, your mask on is your life. Fellow LOCs, the president will not come from up to down. Dr. Atwina will not come from up to down. The district will not come. It is we who stay with these people. Let's go down. Let's enforce the law. Let's enforce the SOPs. We can fight this disease ourselves. I'm kindly requesting you, the struggle continues. Let's work with our people. Let's work within the limits we have to make sure that we enforce the SOPs so that we stay with a healthy society.
Well, I must thank you very much, John Lubega, the chairman, LOC1 Kamuli Zone C, that is Kireka Parish, Namgongo Division, and Kira Municipality in Wakiso District, for really coming to share this important message with us. As the president says, the chairman, LOC1 is a very, very important person in administration of this country. In other words, when it comes to fighting pandemics, they play a key role. In terms of security, they play a key role. And also in terms of service delivery, they also play a very key role. Therefore, because our local government structure begins with chairman, LOC1, and up to the district, and then we go to central government. Manda Kolo Mazima is my name, saying that it is possible for us to kick COVID-19 out of Uganda if everyone of us can play their part.